Hi there everybody and welcome back to my channel. Today's video will be a slightly different video where I take you back to basics and understanding the human eye a bit better, and in doing so this will help you to then try and appreciate why certain eye conditions develop and where they develop. So if you want to learn more, then please stay tuned. So if you look at the picture on screen now, what you will see is the eye in cross section. So essentially the eye has been cut down the middle and you are looking at it from the side. So for orientation purposes, this is the front of the eye, which is the cornea. That's number 2. And then you have the back of the eye here, which is the retina. And then within the retina, you have the optic nerve. The other key big structures within the eye are the lens, the crystalline lens, which is number 5. This large bodied area here, number 7, is called the vitreous body or the vitreous cavity, which contains the vitreous. And this, as you can see, occupies a very large portion of the volume of the eye. The area that is numbered 3 is a space which is called the anterior chamber, and within the anterior chamber of the eye, the aqueous fluid circulates. That is responsible for nourishing certain parts of the eye, including the lens. Number 6 is the iris, and the role of the iris, in and amongst its many roles, is to change the diameter and size of the pupil, which is indicated by the number 4. Now the pupil is the black part of our eyes and the iris is the colored part of our eyes. Now, what the iris does, depending on the amount of light around, it either gets bigger, so therefore the pupil gets bigger, and therefore more light can enter the eye, and this happens in dim conditions, or in brighter conditions, the iris gets smaller, therefore the pupil gets smaller, and therefore less light enters the eye. The purpose of this is so that in dim conditions, you get maximal light entering the eye, and in light conditions you restrict the amount of light coming into the eye so that you don't suffer with things such as glare and blurred vision. So the eye then has 3 specific coats or layers. Those layers are from outermost to innermost. Number 8, the sclera. You then progress in from that and you get number 9, which is the choroid, and that's the vascular layer of the eye. And then you go innermost to that and you have number 10, which is the retina. 2 other important structures to note are number 12 is where the optic disc is, and that becomes the optic nerve. And then number 11 is the fovea. Now the role of the optic nerve is to transmit information from the eye to the brain. The role of the fovea is responsible for giving you your sharp, crystal clear vision. So that's the basics of the core components of the eye itself. So now if we consider how these things may change in disease, so in terms of the cornea, number 2, this can be affected by diseases such as herpes, for example, which could leave the cornea with scars. The cornea could also be affected by trauma, which could leave it with scars. And what then tends to happen is, under certain circumstances, patients may actually require a corneal transplant. Other reasons for corneal transplant could include conditions such as keratoconus and Fuchs endothelial dystrophy. I've previously made videos on these, so I'd encourage you to please watch those. And when the iris develops inflammation within it, you develop iritis or uveitis. We then have the lens, number 5. With the lens, as we get older, it becomes less flexible and it becomes more and more challenging for it to change its shape. And as a result, we lose the ability to focus, and therefore patients end up requiring reading glasses for close tasks. The other thing that tends to happen with the lens is that it becomes cloudy, and as it becomes cloudy, this is where patients develop cataracts. During cataract surgery, a hole is made in the front of the lens here. The lens is then sucked out, and this posterior aspect, as it's called, the posterior bag, remains, and a new lens can then be popped into the bag. So that's where and how a cataract can affect the eye and where a new lens will sit. So a patient's cataract is removed and a new lens is put into the support structures that were already present. However, you now have a new lens to help you to see more clearly. Another common condition that can occur in patients is when this jelly detaches off the retina and therefore off the back of the eye. This condition is called a posterior vitreous detachment, and again, I've made videos on this. But ultimately, as we age, the vitreous body gradually turns to liquid and starts to break up. And there comes a point where the jelly detaches off the back of the eye. Now, the risk with the jelly detaching off the back of the eye is the fact that it could also cause a problem with the retina. And again, if you look at this diagram, the jelly is stuck to the retina. In an uncomplicated detachment of the jelly, the retina will be fine. Whereas if it becomes complicated, you may actually get the development of tears in the retina, and then that puts patients at increased risk of a retinal detachment, for example. The other common conditions that can affect the eyes include glaucoma, which is where you get a buildup of pressure in the front of the eye typically, and then that causes damage to the optic nerve which sits here. And when you get damage to the optic nerve, that means that fibers that usually transmit information from the eye to the brain become damaged, and as a result, it means that the information that was previously getting to the brain is no longer getting to the brain, and as a consequence, patients start to lose their peripheral field of vision and then also their vision itself, so their visual acuity. The last condition to mention, which affects this very small area in the back of the eye called the macula, is macular degeneration. Macular degeneration is an age-related problem, which is where patients get age-related wear and tear changes in the back of the eye. As a result, it affects their visual processing, and patients are no longer able to see critically, and as a result, as the condition advances, they start getting scotomas or black spots in their central vision. There are two types of macular degeneration. There's a dry type and there's a wet type, and I'd encourage you to watch my videos on macular degeneration to learn more about this. Thank you so much for watching this video about basic eye anatomy. I felt it was important to share this knowledge because having a good understanding of the basic principles and anatomy of the eye will then help one to understand how diseases affect the eye. If you like this video, please give it a thumbs up, please like, please subscribe, and please comment. If you've learned something new watching this video, then please do tell me what that is. I'd love to hear from you. Until next time, thank you.